Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir, and the topic is anastomosis of the vessels. Note the communication of the artery to artery, arteriole to arteriole, vein to vein is called as anastomosis of the blood vessels. Note the point. This anastomosis should be at the pre-capillary level, not at the capillary. That is vein to vein, artery to artery, or arteriole to arteriole. And the importance or anastomosis of this function of this anastomosis is to provide a collateral channel in condition in which if the one vessel is blocked. Now let us look at that. This is the brachial artery, and this is the radial artery, and this is the ulnar artery. Look, a branch. Look, from the radial artery, from the brachial artery, descend to anastomose with the branches of the radial artery. In the same way, branches from the brachial artery, superior and inferior ulnar collateral artery, anastomose with the branches of the anterior and posterior ulnar recurrent arteries. That is, branch from the brachial to the ulnar artery, branches from the brachial to the radial arteries, so that if during emergency condition, if the brachial artery is being cut or blocked over here, then the blood was directly sent through this collateral channel to the radial and ulnar artery, and the distal part of the body, that is the forearm and the hand, that will be then irrigated by the blood vessel, and that part will not infarct or necrosed. In the same way, there is anastomosis between the veins. You can see then the cephalic and basilic vein anastomosis over here at the elbow or at the dorsum of the hand. You can see over here these veins anastomosis to form the dorsal venous arch or the arteries. Look, anastomose with one another, radial and ulnar artery at the palm of the hand to form superficial palmar arch. These anastomoses are of different types. Number one is end-to-end anastomosis. For example, you can see over here, the branch of the radial artery and ulnar artery anastomose with one another end to end to form the superficial palmar arch, like this. Or at the stomach, look, this is the stomach. Over here, the right and left gastroepiploic arteries, they anastomose with one another over here, end to end. Then second is the transverse anastomosis. That is, look, from the ulnar artery to the radial artery, branches anastomose with one another transversely. For example, you can see over here at the palmar carpal arch, branches from the radial artery anastomose with the branches from the ulnar artery. And then is the convergence anastomosis. Convergence anastomosis is this. For example, look, this is one vertebral artery and this is another vertebral artery. The two converge towards one another to form one big artery, that is the basilar artery. Such anastomosis is called as convergence. In this way, three types, then end to end, and then cross or transverse, and then convergent anastomosis. Then the other types of anastomosis are arterial anastomosis, and then venous anastomosis, and arteriovenous anastomosis. This I will explain in the next lecture. Thank you very much.